Hi, I'm Mary Cruzy from HealthSource Solutions, and I want to thank you for taking time to hear about our new multifaceted approach to health and well-being. There are many endpoint solutions on the market that help support employees, but there are few solutions that focus on supporting the organization. So I'm going to take the next 10 or 15 minutes to share what this approach is, how we can support you in implementing it, and then identifying if you're ready to take this next step. There is a lot of data and research in the market right now on mental health, and I'm not going to spend time reviewing all that, but what I will share and want to lift up is that the World Health Organization announced in the past few months that depressive diseases are projected to be the leading global burden of disease by 2030. That's 8 years from now. So we need to really take this seriously and start moving forward. As we built our strategy, we did want to define the difference between mental health and mental well-being. Mental health we are defining as the clinical and treatment focused interventions, and mental well-being is really those prevention and intervention focused activities that we support our employees on. 20 to 30% of our workforce is in the need in mental health space where they need that high touch clinical and focused intervention, whereas 100% of our employees sit in the space of mental well-being and appreciate the support and need the support of prevention and intervention activities. When we think about an organizational strategy to mental health, what we define this as is building a supportive, inclusive, stigma-free culture around mental health and well-being. And we reach that by using shared language that everyone understands and acknowledges, by understanding the issues and then knowing the action steps to take, aligning our priorities within the organization, enhancing collaboration amongst departments, and then building on what you currently have. So our strategy is not about erasing what you have worked so hard to build, but to enhance and grow and fill gaps. We built this mental well-being model to help provide a visual of what it takes to support an individual in their mental health and well-being journey. We look at it as an individual perspective, a company or organizational perspective, and then the community and how each of these impacts one another. I'm going to walk through each of these and share with you kind of where we're coming from. So the individual elements are really looking at things like prevention, recognition, and action. So the prevention is helping people understand, working towards a stigma-free culture, knowing what those risk factors are, and kind of building this community of make it okay. The recognition piece is knowing and being self-aware of things, the signs and symptoms, things that I need to be aware of, not only for myself, but for my family, for my colleagues. When do I seek help or encourage someone to seek help? And how do I start those difficult conversations? And then lastly, for the individual, it's about action. What am I doing in that prevention, well-being space to help myself build those resiliency skills? So I have things to fall back on when times are stressful. In the company influencers, we're looking at support, collaborate, and communicate. And the support falls into that. What are the resources, the trainings that we can provide? What kind of policies do we need to look at or maybe reinvent a bit? In the collaboration space, it's how do we get interdepartment using that same or common language? How do we support each other? We think about safety and mental health and mental well-being. It's not rocket science to know that people are more apt to get hurt if their head isn't in the game, if they're really not focused on what they're doing because they're thinking about something else. So all of these play a role with each other, and it's about how do we build this collaboration amongst these departments so we again have the common language and the common thread that's going to weave through all of them. And lastly is that communication piece. We need to communicate, communicate, communicate. You always hear, well, I didn't know about it. Well, We need to communicate. And we can do that through social connection. It's about keeping things aware, the awareness that they're alive, they're visible all the time. And it's about building that acceptance throughout our communications. Lastly are those community factors. And there's three pieces that we lift up here. That's socioeconomic, it's the environment, and it's access. And you think, well, we don't have direct impact on community factors. What we want you to understand is what your demographics and what could be issues for them and what's a good representation for them. We know in socioeconomic that if you're having financial stress, and it could be anywhere from living from paycheck to paycheck to getting in debt to planning for the future. There's housing issues, is there stability around housing, food insecurity, the employment, are they afraid they're going to lose their job? So these are all factors that clearly impact our mental health and well-being. When I look at the environment, we're thinking about things like walkable communities, safety. Do you feel as though when you leave, if you leave late at night from your organization, do you feel safe? Do you feel as though there's some place you could turn to? And then it goes to things like even being accepted, not only within your organization, but within the community that you live. And lastly is access, and I'm going to really lift up access, especially in the area of healthcare and mental health. We know rural areas have so struggled with this and continue to struggle with it. There's new solutions coming to the market, which is very exciting, but that's a big concern of people is, do I have access to care? So as we shift to the strategy that we built out for this, it's really focusing on three core goals. The first one is to build a supportive, inclusive, stigma-free culture around mental health and well-being. The second is to provide ongoing training, education, recognition, action to support mental health and well-being. And the third is to build the infrastructure to support the program sustainability through time. And that will be built through leadership engagement, policies, tools, and resources. This is not meant to be a one and done. It's not meant to be a program. It's meant to be an initiative that takes on the hold of your culture and becomes part of who your organization is. I love, someone said, really mental health and mental well-being, and quite frankly wellness in general, should be a core value of your organization, not a program or an initiative. It should be part of who you are. So we're going to lift up and help support this who you are in your organization by laying out a strategy. In this strategy, those three goals that I just spoke about is what we've built the strategy around. We broke it into 4 phases. And the reason we did that is because people are at different levels and different spaces within their organizations and what they have done. So this is not, again, meant to be year 1, year 2, year 3. It's meant to flow through, and you may be in phase 1 and part of phase 2 all at the same time. Phase 1 is about driving awareness, and we have that built around what are we going to do for the employee and what are we going to do to help focus the company. Phase 2 is about taking action, again with the employee and the company. Phase 3 is about leading change, and phase 4 is that measuring impact. So I'm going to walk you through each of these phases to give you a little bit deeper dive about what it is, and then some of the tools we have to help support that. So when we look at that drive awareness, the first thing we want to do is assess. We need to know where we are and where we headed. And that we do through a company inventory that we specifically built with a lens of mental health and well-being on it. The employee survey, and this survey is to identify areas that the employee feels the company needs to be working on. So there's that gap in perception. And lastly is an individual assessment or well-being tool that employees can say, how am I doing in the scope of this? And then the raise awareness, of course we want to start with senior leadership, and managers. What is your role and how can you help support this? And then move into communicating it to the employees, and finally working towards this make it okay or breaking the stigma of mental health and well-being. Many people don't go into their for mental health because they're afraid of what people think. So how are we supporting you on this? We have all the tools and templates built out on the back end. So we have a company assessment that we go through with you, and it's really used for you pre-post to see how far you've come. We have an employee assessment, again, for the corporate view of from employee to company. We also have one for the individuals. And then when you think about the language and helping around resources, this is where we're bringing in outside experts to help with those trainings for employees and leadership. Phase 2 then is taking action. This is where we're going to roll up our sleeves, and again, some of this might be happening even though you don't have phase 1 built. But the 3 core areas are to increase knowledge, to promote self-care, and department collaboration. And the increased knowledge is really going to be focused a lot around those trainings, making sure that people understand the signs, symptoms, and when to seek help, that you all employees, leaders, and managers understand the resources available to them. So it's really lifting up those conversations to a new level. The second one then, promoting self-care. I'm going to spend a little bit more time on this in a minute, but it's really helping those people look at those immediate coping skills, their physical, social, emotional, and purpose and meaning. So it's wrapping this all together within the pillars of well-being. The departmental collaboration then is getting departments that have a vested interest in their employees to start to work together to build this common language, to have a common thread around mental health and well-being. And this is oftentimes where department groups end up doing this in silos. Safety has an initiative, stay focused, because we know that people are at greater risk of injury if they're thinking about something else and not the job that they're doing. So we're trying to meld those silos together so that employees feel like there's this common theme, there's this common language, there's a common thread. So here's the resources that we have built out on the back end to support you. So we have those communication tools ready to go. We have some simple programs. We have environmental kits that can help with this. In the middle here, you're seeing a resiliency pyramid that HealthSource developed. And the idea behind the resiliency pyramid is to be a front-end tool to share with employees, and that we're helping employees to manage, to build, and to develop those resiliency skills, resources, intuition. So the immediate coping skills is at the top. Those are the things we often talk about: deep breathing, visualization, quiet reflection. But then we want to get into those long-term support through daily supportive activities, social networks. Are you doing things to bring joy and happiness to your day? Emotional activities, connecting with others, sharing a common bond within something. And then those lifelong foundations, and in a nutshell, it's kind of, do you have that meaning and purpose, and do you know how you're going after it? It can be also about building meaningful relationships, and what is often termed in the mental health and well-being world is, do you kind of have your pit crew, the people that you can lean on and turn towards if you're having a rough time. Phase 3 then is really kind of looking behind the scenes with the organization, and that is looking at things like policy. It's how do we create more manager accountability and support for employees from their manager. It's enhancing those social support networks that employees might need, and that can be certainly tied in with employee resource groups as well as DEI. There's a lot of, again, interdepartment collaboration. Those environmental improvements, it could be simple things, and I'll share in just a second what that might look like. And then incorporating mental well-being into the corporate goals. This needs to be something that's not a flash in the pan or something that's gonna, kind of, again, go back to that check the box analogy. This is something that the company needs to embrace, so it's a long-term initiative that's going to turn into the culture of your organization and hopefully a value. So when you think about culture, some of the top line things, culture is a big thing to change, and it's not anything that's going to change overnight. I often use the analogy, it's like turning a barge. It's going to take time, and when I say time, probably 3 to 5 years, if not even a little bit more, but we need to keep each year looking at what's the next thing. So some of the things that we have is more that immediate support. So that is things like toolkits on how do we help you with policy. We're going to review some of those policies and what could potentially change. Again, we understand it takes time to change benefits, it takes time to change policies, but you have to start. We have environmental kits that look at things, simple things you can do within your organization, typically that are pretty low cost. It can be anything from a quiet room to building a space outdoors for people to go, implementing a resiliency break within longer meetings, or a simple gratitude board. These are all things that we have behind the scenes with lots of ideas to help support you on implementing those things that make it feel in your organization like, they do care about me. And lastly is phase 4, and that's measuring impact. And quite honestly, phase 4 and phase 1 do somewhat go together because we have to assess that progress. So we need to put those assessments forth and then look, how much did we accomplish over this past year? This is a little bit different than looking for an ROI out of this, because these are things that you're going to do that you will probably feel that change in 3 to 5 years. And I'll share that with some of the other resources. So how are we going to evaluate your company culture? It's understanding the impact of community factors, which is really understanding the demographics of your population and what might you do to help support that. And lastly, determining that future sustainability. How do we keep this going? How does this become woven into our organization as who we are? So the measuring impact, where we start with you on, is we provide progress reports on how you're doing on those goals and that assessment. We work with you to build an annual plan that has goals and metrics attached to it, so this all begins to feather together about how we'll help you. I look at that corporate resiliency survey. That was, again, the employees kind of evaluating the company on how well they think they're doing. So pre-post, if we see a change in that, that means that yes, we have entrenched, we have gotten down into the population and understanding our engagement there. And then lastly, that probably will come in year 2 or 3, a little bit later, is what kind of internal measures do you want to look at to say, how are we doing on this? You know, certainly EAP utilization comes out to be a pretty objective thing that you can grasp hold of. But then there's also things like, you know, retention and recruitment. Is this, are we building a culture that people want to stay in? It could be safety incidents. It might be absenteeism if you track that, or healthcare utilization. So these are all areas that we can start to dig deeper in once we kind of get that foundation built. So what do you get with HealthSource? We're going to provide you that guidance and accountability. We have monthly meetings with you. We're going to have regular touch points with you. So we're going to help keep this process moving forward. We understand how easy it is for a big initiative to sometimes take a back burner when something else comes. The fire is bigger in another area. So what we want to do is make sure that the fire keeps burning, and understanding, of course, things may change and we may need to re-gauge things, but we're there to help with that, pushing the peanut forward, as I say. The tools and templates, we have built out assessment tools, we have annual plans with goals and metrics, we have communication tools built out. So it all kind of comes to you. We customize it specific for you, so it doesn't just feel like a canned thing. This is going to have your look and feel of your organization. We will help you connect to facilitators specifically to work with leadership, one for managers, and then one for employees. So we understand that those 3 demographics are going to have different issues and concerns that are going to be raised through this, and we want to make sure that those get addressed and the trainings are there. And then programs and resources, I shared just a few samples with emails and newsletter content, programs that we have already built. If you don't have other areas if you have other programs that you'd rather put in, we understand that, and we are going to support those just as equally. The last thing then is these mental health toolkits that I shared. We will work with you to overview those organizational policies. We're going to help you set expectations and standards for your program so that it's within reach. And each year that reach might become a little bit higher, but it's in reach with what you can get done in your time and at your pace within your organization. So I said I'd say, are you ready to do this? This is some key questions that we ask our groups to think about before they take on an initiative like this, because one of the things with this mental health and well-being is you don't want to go in halfway. You're going to go in and you're going to help move it forward, or wait till you're ready to do that. So is your company or organization ready to identify mental health and well-being as a strategic priority? That this is really important, we need to do this. Is there a senior champion that will take this under their wing and kind of lead out and champion this whole initiative? Can the company commit a budget for both the implementation that we would support you with as well as trainings? Making that institutional change. Are you open to saying, hey, it might be time to relook at things? Assigning a point person, we do need somebody to help continue to move this forward that's in-house in your organization. We guess that this takes about 4 to 6 hours a month. So it's not a humongous amount of time, but we do want some dedicated time. And lastly, and most importantly, does this align with your organizational values? Are you an employee-centric company that really feels like this is the next step that we need to do? This initiative, we look at paralleling with your wellness program. If you have one, we want them to move in similar tracks, but to try to bury this into your wellness program, we're afraid it will become overwhelming. It will probably end up watering down one or the other. So we do look at this as kind of being a separate or parallel initiative to what you're doing within your well-being program. So in closing, I want to thank you again for your time. And this is the time to seize this issue. We need to work to destigmatize this topic, encourage intervention in many different forms, and to create a culture of inclusion and acceptance. And that is what is supported through our mental well-being model with individual, company, and community support. Thank you again.